Good afternoon. I'm Maddie.
I'm Cammie.
My name's Alex.
Today we are going to discuss the difficult topic of the LGBTQ community and suicide. What are the rates actually like? What are the factors that cause this? How can we help prevent suicide? So to start off, why are we having this conversation? Why is this conversation important to have for this particular group?
Well, many people's lives have been touched in some way by depression or suicide, and it isn't a problem that discriminates between sexualities, especially when it is caused by naturally occurring mental illness such as depression. Depression and suicide are already important topics to tackle because people are so quiet about these issues. But in the LGBT community, the frequency and the prevalence of self-harm and suicide attempts are much higher.
There needs to be more conversation about why that is. I don't believe for 1 second that something about being part of the LGBT community inherently makes you several times more depressed or likely to hurt yourself.
Before we continue the conversation, let's go over the warning signs. What should we look out for in ourselves or in others that may clue us in that we need to ask for help or encourage a loved one to ask for help?
If you or someone you know does not care about their future, saying something like, "it won't matter soon anyways," they might put themselves down and think they deserve this, saying, "I don't deserve to live, my life sucks," expressing hopelessness, saying goodbye to important people. They might have a specific plan for suicide, saying something like they thought about this before.
Or if they talk about feeling suicidal, saying, "Life is so hard lately, I felt like ending it all." Or if you or someone you know has been using drugs or alcohol more than usual, or acting differently than usual.
Some other signs include giving away their most valuable possessions, losing interest in their favorite things to do, admiring people who have died by suicide, planning for death by writing a will or letter, eating or sleeping more than usual, feeling sick or tired or lethargic, things like that.
If these things apply to you or someone you know, please ask for help. And we'll be talking about where you can go for help later on. There are a lot of people who don't think asking for help is an option. What are the obstacles around reaching out for help?
Well, there can be an unsupportive environment. Maybe they live in an area where it is not easy to even go anywhere for help. There is also a lot of stigma surrounding therapy. Many people are at that mindset that asking for help makes them feel weak, and there is shame associated with reaching out for help when you need it, when there shouldn't be. Never be afraid of asking for help. Take care of yourself, and don't be ashamed over doing what's best for you. If you live in an environment where you cannot talk to people around you, there are always hotlines you can call, instant messaging, texts, emails, all kind of services to provide you with support, even if there is not support where you live.
Let's get right into this now. What are the facts? What is going on for the LGBT community that's leading to these suicide rates?
Well, for example, the prejudice, bias, harassment, and persecution of LGBT people is incredibly common and cited by the CDC to be a major risk to the LGBT community's health and safety. Even in communities that have a reputation for having a higher tolerance for people of all kinds, there's still mistreatment and abuse put upon and suffered by adults and youth who identify as LGBT.
Often, LGBT people can be very isolated by their families and friends, schools, churches, and community overall. This amount of mass isolation causes high amounts of depression and suicidal ideation. These people are often made pariahs, treated with hostility, harassment, or violence, or ignored.
There is a high percentage of LGBT teens who face homelessness in the United States. Research suggests that though LGBT youth make up about 10% of the population altogether, LGBT teens account for between 30% and 55% of all the homeless youth. This rate is largely due to these teens being disowned by their families or running away in an attempt to escape hostile environments due to their sexuality or gender identity.
There's an almost complete erasure of LGBT people's contributions to our history. There are even laws in 8 different states prohibiting LGBT material from being taught in public school curriculums, which results in young people feeling isolated, as does media stereotyping and erasure of LGBT characters. There are very few programs or organizations for young LGBT people in schools, or made available in the average neighborhood. Sexual education provided at schools often does not address LGBT sex, which leads to higher probability of contracting STDs.
All of these factors contribute to forcing LGBT youth into a lower quality of life. Many studies show that LGBT people are 2 to 7 times more likely than heterosexuals to exhibit suicidal thoughts. Studies suggest that about 4.6% of the US population has attempted suicide. Of that 4.6% of the whole population, there's about a 30% lifetime suicide attempt rate for the gay and lesbian population, and a 21% lifetime suicide attempt rate for the bisexual population.
Studies also suggest that the transgender population has an average suicide attempt rate of 41%, despite only making up about 1% of the US population, as far as we know. Over the last several years, the news has been flooded with cases of LGBT teens who have taken their own lives or attempted to do so because of factors like these, and the resulting depression they cause. For example, in September of 2010, there were 6 cases of suicide in LGBT teenagers just in the United States.
Studies have found that 85% of people who identify as something not heterosexual report having experienced verbal harassment based on their sexuality. 44% being physically harassed based on their sexuality. A study conducted by the American School Health Association found that 44% of participants who have been harassed in schools have been diagnosed with clinical depression as adults. 41% of participants who have been harassed had attempted suicide 1 or more times in their lifetime. Also, 41% of participants who have been harassed for their sexuality in school become heavy drinkers, and 56% of participants report substance abuse.
Suicidal behavior is not always defined as an active attempt to kill oneself, but can also be a lack of regard for your own well-being and health. 27% of participants had also been diagnosed with an STD, and 31% had knowingly put themselves at risk of HIV transmission within 6 months of the beginning of the study.
2/3 of the participants who were highly victimized reported suicide attempts, and were 5.6 times more likely to make at least one suicide attempt in their lifetime that would hospitalize them. These participants were also 2 times as likely to be diagnosed with an STD and twice more likely to knowingly risk HIV transmission than those who had not been harassed or victimized in school or at home.
So, we've gone over some of the circumstances that lead to these upsetting figures. There's a huge gap between the suicide and depression rates between heterosexuals and LGBT people. Let's discuss some more of the factors the LGBT community faces that leads up to depression and suicide.
Like stigma upon the community?
Yeah, many people just have no idea who LGBT people are or how they should treat them, and they're misguided and they react in fear to what they don't understand.
Also a lack of community?
Yeah, and job loss. There's still so many states that have no law to keep LGBT people from being fired based on their sexuality or gender identity.
Harassment, whether it's physical, sexual, or verbal. A lack of visibility in schools and history, in media, and in public figures. Rejection also can lead to suicidal thoughts, and also a lack of education about LGBT issues.
There's also higher homeless rates due to being kicked out or running away from a hostile environment. Lack of training for teachers, medical professionals, police, that list goes on. And isolation.
A concept analysis of the isolation of LGBT people by the Journal of Advanced Nursing was formulated into 5 socially constructed groups and 4 subgroups. The focuses of these groups were social isolation, cognitive isolation, identity concealment, recognition of difference, and emotional isolation, which flows into the subgroup of lack of social support, no contact with the LGBT community, social withdrawal, and victimization, all of which lead to one another and in turn lead to isolation.
The concept analysis states that any instance of LGBT depression or suicidal thoughts, one of these groups or a combination of any of these groups can be applied to a contributing factor, and the elimination of all these groups can be a preventative measure to keep LGBT people secure and mentally healthy. So what can we do about these factors and struggles?
Studies show that when LGBT youth are raised in a supportive and nurturing environment, they're much less likely to suffer depression or consider suicide. So the answer is to, just not harass LGBT people. Don't hate others for their sexuality or gender identity. Don't teach your kids to do that either, and just support and love your child. That sounds obvious, but it's probably easier said than executed. There needs to be a big change to the way the institution is run. Preventative precautions should be implemented to increase the level of emotional security for LGBT citizens, because this absolutely is a life-threatening problem for a significant population.
More comprehensive laws must be passed. Anti-discrimination laws banning conversion therapy, laws to keep doctors from refusing to treat LGBT patients, and programs in schools and communities, as well as churches and hospitals, should focus upon removing the stigmatization of LGBT people and treating discrimination against LGBT people as it is, a threat to their lives.
Implement mandatory training in sensitivity and LGBT issues for teachers, public servants such as police and doctors, and also therapists. Individual cities across the U.S. are already doing this, but it needs to be done on a national level.
I think that visibility is a big one. Often people distance themselves from LGBT issues and dehumanize the community because they believe they don't know any LGBT people. I think the more people that come out proudly, the more people will understand that these are your neighbors, your friends, your siblings, your children, maybe your parents. It's not guaranteed, but often when people have a personal stake in these issues, they're more understanding. However, you know your own circumstances best. If you don't think you'll be safe coming out, then don't do it. Above all, take care of yourself.
Please let your friends and family know that you are there to support them, and you will be there for them. Encourage self-care and hope.
So, what are some programs that provide support?
The Trevor Project is a good one. It's a national crisis hotline that offers many services. There is the National Suicide Prevention Hotline and many local mental health offices. Even if you just need someone to talk to, there's an online instant messaging support group. Having many positive relationships with coworkers, friends, or family members.
So, if you're listening to this, then you're probably already on our website. On the left-hand side are links to crisis hotlines and additional contacts in case you really do just need somebody to talk to. So this conversation seems about ready to wrap up. Once again, this is Maddie
And Camille.
And Alex.
for LGBT Suicide Prevention and Intervention. We'll leave you with this message.
You are important to this world, and it is worth it to reach out and keep fighting.